Welcome back to the Deep Dive. Today we're tackling something huge, a global health issue that honestly often flies under the radar. Traumatic brain injury, or TBI.
Yeah, it's surprisingly widespread.
We're not talking small numbers here. Think about this. Over 50 million people suffer a TBI every single year.
50 million.
And the economic hit. Globally, it's estimated around $400 billion a year. It's just massive, relentless, and maybe a bit overlooked.
Definitely overlooked in the public consciousness, I think.
So our mission today is to really dig into this using a major data set, the Global Burden Disease, the GBD 2021 study. It covers, what, 204 countries?
That's right, 204 countries tracking trends from 1990 right up to 2021.
Okay, so we need to cut through that data, figure out the real scale, and maybe understand why our prevention efforts aren't quite matching the problem.
And that why immediately throws up a really interesting paradox, actually. The headline finding is, well, it's a bit confusing at first glance.
How so?
Well, on one hand, if you adjust for things like age and population changes, the standardized rates, they're actually declining globally for TBI.
Okay, so that sounds like good news. Like treatments and prevention are working.
Exactly. It suggests that, yes, some of the medical care, maybe some prevention strategies are having an effect, but, and this is the tension, is the raw numbers, the absolute count of new cases, and importantly, the total number of people living with long-term TBI disabilities. That's going up relentlessly.
Yeah. Okay, so progress masked by sheer volume.
Precisely. It's a classic demographic effect. Maybe let's quickly define what we're tracking here, just so everyone's on the same page.
Good idea.
So the GBD study looks at three key things. Incidence, that's just the new cases each year. Prevalence, that's the total number of people living with TBI right now. And then years lived with disability, or YLDs. That tries to quantify the health burden, the loss of healthy life years due to these non-fatal injuries.
And TBI itself is defined as?
Right. It's any change in brain function or physical damage to the brain caused by some kind of external force, a blow, a jolt, penetration.
Got it. So let's put some concrete numbers on this for the most recent year, 2021. How bad was it?
Well, in 2021 alone, the estimate was over 20 million new TBI cases globally.
20 million new injuries.
And because these injuries often have lasting effects, that contributed to a total prevalence of nearly 38 million people living with a TBI that year.
Almost 38 million people affected. Wow. Okay, now the trend you mentioned, 1990 to 2021, this is where that paradox really hits, right?
This is it. Despite all the medical advances we hear about, the absolute number of people living with TBI, those prevalent cases, shot up by over 50% in 3 decades.
50% increase. That's a huge growth curve.
It really is. And that's exactly where the focus needs to be, I think. The absolute rise is startling. But remember the progress bit.
Standardized rates, yeah.
Exactly. Those age standardized rates, which give us a fairer comparison over time, they do show improvement. New case rates dropped by about 20%. Prevalence rates also dropped significantly, around 16.5%.
So real progress is happening underneath it all.
Yes, but it's just being completely swamped, swallowed whole, really, by two big global forces. Population growth, just more people around, and maybe more importantly, population aging.
Aging. How does that factor in so strongly?
Older populations are simply more vulnerable to certain types of injuries that cause TBI, especially falls. We'll get to that.
Okay. And we need to care about this growing absolute number because the long-term impact, right? This isn't just about the initial injury.
Not at all. The study projects TBI will stay the #1 cause of disability among all neurological conditions right through 2030.
Number one, ahead of things like Alzheimer's or stroke.
Set to outpace them, yes. TBI isn't just about the trauma itself. It's often about the decades of disability that can follow.
Right. So if we want to tackle this, we have to know the causes.
Yeah.
What's actually driving these injuries?
The data is incredibly clear on this, actually. Globally, the #1 cause in 2021, falls.
Falls. Really? Not car crashes or violence?
Falls. They accounted for nearly half, 45.2% of the age-standardized incidence rate. It's kind of counterintuitive, isn't it? People often focus on the more dramatic, high-impact stuff.
Yeah, definitely. So why falls? Are they just more common?
They are incredibly common, especially as populations age. But there's also a point about severity here. Road injuries, they're the second biggest cause, about 25%.
Okay.
Now, while there might be fewer road injury TBIs compared to falls overall, they often result in more severe TBIs. Think about the forces involved in a car crash versus a simple trip.
Higher energy impact. Makes sense.
Exactly. But, and this is crucial, you absolutely cannot underestimate falls. They contribute massively to the long-term burden, those YLDs we talked about.
Even a seemingly minor fall.
Especially in older adults, yes. A concussion from a fall can easily trigger a downward spiral, reduced mobility, fear of falling again, social isolation, leading to chronic disability.
Okay, so falls are number one, road injuries number two. What else?
After that, you've got interpersonal violence, about 9%, and then exposure to other mechanical forces, maybe workplace accidents, things like that, around 9% too.
But you mentioned regional differences earlier.
Yes. This is where it gets complex. While falls dominate the global picture, if you look at specific regions, the pattern shifts.
Like where?
In places like North Africa, the Middle East, parts of sub-Saharan Africa, traffic accidents actually overtake falls as the leading cause of moderate to severe TBI.
Interesting. So road infrastructure, driving habits.
Seems likely, yeah. It suggests the type of trauma reflects the local environment and maybe development level. And you see other variations too. Mechanical forces were the top cause for minor TBI in places like Australasia and southern Latin America.
So a public health campaign in, say, Saudi Arabia needs to focus heavily on road safety.
Probably, yes. Pedestrian safety, vehicle standards, enforcement.
Whereas somewhere in maybe Germany, the focus shifts much more towards preventing falls in older adults at home.
Exactly right. That patchwork of causes demands really tailored, localized interventions. You can't just apply a global strategy everywhere.
Speaking of localized issues, let's talk geography. Where is the TBI burden actually heaviest?
The highest rates for both prevalence people living with TBI and the disability burden, the YLDs, were clearly seen in Eastern and Central Europe.
And what's driving it there?
Primarily falls again, consistent with aging populations in those regions, perhaps.
And are there specific countries that stand out with really high new injury rates?
Yes, the data showed particularly high age-standardized incidence rates in Saudi Arabia and also Afghanistan in 2021.
Afghanistan. I guess conflict plays a role there.
It certainly could, alongside other factors.
Yeah.
It highlights how national circumstances, whether conflict or unique infrastructure issues, can create these hotspots.
You mentioned Australasia earlier as an interesting case.
Yeah, it's a really good counterexample. Places like Australia and New Zealand, they actually had quite a high incidence rate. Lots of new injuries happening.
Okay, so lots of people getting hurt.
But, and this is key, they had relatively low prevalence and YLD rates. The long-term burden was lower.
Why? What explains that difference?
It strongly suggests the quality of their healthcare systems. Good immediate trauma care, effective rehabilitation services. They seem to be much better at interrupting that pathway from the initial injury to long-term chronic disability. People get hurt, but they recover better.
That makes a huge amount of sense. The system matters just as much as the injury type.
Absolutely.
Okay, let's shift from geography to demographics.
Okay.
Age and sex. Who is most at risk?
Generally, rates are higher in males across most of the lifespan, but the peak risk age tells an interesting story.
Go on.
For males, the highest number of new cases happens quite early, typically ages 20 to 24.
Young men. Risk-taking behavior.
That's the usual explanation, yes. More likely to be involved in things like risky driving, contact sports, certain types of work accidents, perhaps.
But you mentioned aging populations being key earlier.
Yeah.
Does that pattern hold?
No. This is where that demographic shift really kicks in. Men dominate the TBI stats in youth and middle age, definitely. But when you get into older age groups, say 75 and older, that risk pattern completely flips.
It reverses. Women become more at risk.
In terms of new incident cases, yes. Men under 75 had higher rates, but over 75, women did. And for the prevalence and disability burden, that crossover happened around age 80.
Why the flip? Just longevity.
Primarily, yes. Women tend to live longer on average, so they have more years spent in those older age brackets where fall risk becomes the dominant factor. For females, the peak for living with TBI and related disability actually came later, around 65, 69 years.
So prevention strategies need to be really age and gender specific then. What works for a 22-year-old guy is useless for a 78-year-old woman.
Completely different risk profiles, completely different interventions needed.
Okay, that leads us nicely into socioeconomic factors. Does development level play a role in who gets injured and how well they recover?
It seems to, significantly. The study used something called the Socio-Demographic Index, or SDI, to look at this.
Right, the SDI. Remind us what that measures.
It's basically a composite score for a country's development. It combines income per capita, average education level, and fertility rates essentially ranging from low development to high development status.
And what did the SDI analysis show for TBI?
A very stark picture of inequality, actually. The countries in the high SDI group, the most developed nations, saw the biggest reductions in their age-standardized incidence rates since 1990.
How big a reduction?
They cut those rates by almost a quarter, about 23.5%, so their prevention and treatment efforts seem to be paying off in relative terms.
Okay, and what about the other end of the scale? Low SDI countries.
That's where the story is less positive. Those regions showed minimal, almost no change in their age-standardized disability rates, the YLD rates, over the same period.
So the benefits of progress aren't really reaching the poorest regions in terms of reducing long-term disability?
That's what the data suggests. It's quite concerning. The gap is widening.
Why such a big difference? What's going on in low and middle income countries, the LMICs?
Well, remember the causes. In many LMICs, road injuries are a primary driver of TBI, often leading to more severe injuries to begin with.
Right.
But then the outcomes are often made worse by systemic issues. First, inadequate trauma care systems. Just getting effective help immediately after a major accident can be a huge challenge. And second, a real lack of consistent access to post-acute care, rehabilitation, ongoing support.
So even if you survive a severe TBI,
Your chances of significant life-altering disability are just much, much higher in a setting without robust follow-up care.
okay, so let's loop back to falls then, since they're the global leader, especially in older adults, right?
Absolutely critical. The study points out that falls in people over 65 account for something like half of the 10-year mortality risk linked to TBIs.
Half the mortality risk
Yeah.
just from falls. Wow.
So preventing falls in the elderly has to be a top priority. And the good news here is that interventions do work.
What kind of intervention?
Relatively simple, often multidimensional things, like providing older patients, maybe in hospitals or clinics, with a tailored, patient-centered fall prevention toolkit assessing their individual risks. Home safety advice, exercise programs, medication review.
That makes a difference.
The sources suggest these kinds of bundled interventions can achieve maybe a 15% reduction in falls among inpatients. That's a really solid return on investment for a relatively low-cost public health measure.
Okay. Important progress possible there. Before we wrap up, are there limitations to this GBD data we should be aware of?
Yes, definitely. It's crucial context. A big one is that the GBD study relies heavily on data from formal healthcare systems, hospital records, official statistics, meaning milder TBIs, like many concussions that don't result in a hospital visit or maybe aren't even diagnosed properly, are almost certainly undercounted. We're likely underestimating the true scale, especially of milder injuries.
So the 50 million annual figure might actually be conservative.
It could well be, yes. Another point is about specific causes. Sports-related injuries, for example, are a known major contributor to TBI, especially concussions.
Right.
But in this data set, they aren't pulled out as a separate category. They get lumped in under broader headings like falls or exposure to mechanical forces. So we can't quite quantify the specific burden from sports using this particular study.
Got it. Important caveats. So let's try and pull this all together. What's the big picture takeaway for you, for our listeners?
Well, I think it comes back to that paradox. Yes, there's some encouraging progress when you look at the standardized rates suggesting we can make headway.
Sure.
But the sheer absolute number of people living with TBI and the associated disability is growing. And with global populations aging, that trend is likely to continue unless we significantly ramp up our efforts.
So it's a persistent, growing global health crisis.
Absolutely. And the key is that it's not one single crisis. The data screams for regionally tailored approaches. Better trauma systems and road safety in lower SDI regions where severe injuries from traffic dominate.
And relentless focus on fall prevention in higher income, aging regions like Eastern and Central Europe, where that's the main driver.
Exactly. The high burden regions and the leading causes, especially falls, need urgent, targeted action. The blueprints are kind of there. We know some things work.
It's about implementation and resources now.
Political will, resource allocation, yeah.
Okay, so here's a final thought to leave you with. We know falls are the leading global cause, and they're largely preventable, right?
Many are, yes.
And we've seen that high SDI countries, the wealthier ones, has managed the biggest rate reductions. But the actual disability rates in low SDI countries have barely budged. Doesn't that suggest there's this massive, maybe untapped opportunity? Could targeted, relatively low-cost public health investments, particularly around fall prevention and basic trauma system improvements in LMICs, have a huge impact?
It certainly poses the question, where do you get the most bang for your buck in terms of reducing long-term suffering?
Exactly. So here's your thought experiment for the week. If you had, say, $10 million to spend specifically on TBI prevention in the developing world, based on this data, what single strategy would you prioritize for the biggest impact? Something to think about. Thanks for diving deep with us today.
Thanks for having me.